Kujawsko-pomorska e-Szkoła kłania się. Witamy Was serdecznie na lekcji języka angielskiego. Pan Maciej Doksa w studio razem z nami. Dzień dobry. Jeszcze raz, Panie Macieju, nie włączyłem Panu mikrofonu.
Okej.
Przepraszam najmocniej. Dzisiaj lekcja o wizycie u doktora, o wizycie u lekarza. Wyobraźcie sobie taką wizytę w Anglii albo wyobraźcie sobie taki temat na maturze, bo i tak może się zdarzyć, prawda, Panie Macieju?
Yes, of course. It's quite possible that you are going to talk about a visit at the doctor's. So, as we have already said, today we are going to talk about a visit at the doctor's. This is a subject which is quite, I would say, popular, trendy nowadays, considering the pandemic situation. So we are going to talk about, yes, what happens when we visit the doctor. So, first of all, when you want to see a doctor, you have to make an appointment. We usually don't just go to the doctor without making an appointment. What does it mean? Well, to make an appointment means that you usually call the doctor to set some day and time when you will have this visit, or you just go to the registration office and they make an appointment for you. In Polish it is umówić się na wizytę u lekarza. Well, when you go to the doctor, where do you go? What are the names of these places where you can actually see the doctor? So usually the doctor sits in a special room, not very big one, where he sees his patients. In English, such room, doctor's room, is called either doctor's office or the surgery. Surgery, czyli gabinet lekarski. You have to be careful about this word, because in English this word has two meanings. Surgery can mean gabinet lekarski, but it can also mean an operation on your body, czyli po prostu operacja chirurgiczna. But here we are talking about the first meaning, so you see the doctor in the doctor's surgery, czyli w gabinecie lekarskim. The doctor's surgery is usually situated in a bigger building where there are more such rooms, more surgeries, and more doctors. And such a place is, in English, usually called a health center or a clinic, sometimes a practice, czyli przychodnia zdrowia. Yeah? So when we are sick, we make an appointment and we visit the doctor at the surgery located in the health center. Now, when you are suddenly quite seriously ill, so your condition is serious, there is something serious going on, or when you have had an accident, so something happened to you quite suddenly and it's dangerous and it's urgent, you can be seen by a doctor at a place which has, well, many different names depending on the country, but it can be called A&E. What does it come from? Well, A&E is accidents and emergencies. In Polish, pogotowie, izba przyjęć. Or it can also be called, especially in America, ER, emergency room, which is also pogotowie, izba przyjęć. So then you are usually taken by an ambulance to A&E or to the ER, and there you are seen and examined by a doctor. All right, so when you are at the doctor's, when you have a visit at the doctor's, there is some conversation between the doctor and the patient going on. There are some things that the doctor can ask you, there are some things that you can ask the doctor, there are some things that you have to tell the doctor. So what's The matter is usually the first question that the doctor can ask you, czyli co się stało, co panu dolega, i tak dalej, i tak dalej. Another way of saying this is what seems to be the problem. Yes, so what's wrong with your health? So what's the matter? What seems to be the problem? Now, when you answer this question, you usually generally say what's happening and you basically describe your symptoms, czyli objawy. Well, usually the doctor wants to know more about your symptoms, wants to know more details, so he or she can ask you another question. Can you describe your symptoms? Czy może pan, pani opisać swoje objawy? Jakie ma pani, czy też pan objawy? You describe your symptoms. You basically say what the matter is with you. And then very often the doctor will ask you, how long have you had this, if it's one symptom? So for example, how long have you had this rash? Or how long have you had this pain in your shoulder? Or if there is more than one symptom, the doctor will ask you, how long have you had these? For example, how long have you had these bruises, if it's more, siniaki, yes? Or how long have you had these problems with, I don't know, walking or keeping balance? Another thing that the doctor may want to know is whether you already are taking any medicines. So the question can be something like that. Have you been taking any medicines? Czy bierze pan, pani jakieś lekarstwa? Also, another thing that the doctor may want to know is whether you suffer from any other diseases. Suffer from a disease, cierpieć na jakąś chorobę, chorować na coś. So the question will be, do you suffer from any disease or any other diseases? A similar question is the question which you can see as the last one here. Do you have any ongoing health problems? Ongoing, czyli jakieś takie ciągłe, chroniczne, ciągnące się od jakiegoś czasu problemy zdrowotne. So do you have any ongoing health problems? So something that has been going on for quite some time until now. Czyli właśnie, czy ostatnio cierpi pan, pani na jakieś problemy zdrowotne. As we said, one of the questions that the doctor can ask you is the question about the symptoms. And of course, then you have to describe your symptoms. We have already talked about symptoms of some diseases in our previous lesson about diseases and symptoms. But now we can talk about some more of them. So the first one is, I have pain in my back. Czyli dosłownie odczuwam ból w plecach. Generally in English you can say I have pain in my, and then you say the part of your body where this pain is actually located. So I have pain in my back, I have pain in my leg, I have pain in my stomach, or I have stomachache, I have pain in my neck, and so on and so on. Another way of saying that you have pain in some part of your body is to use the verb hurt or ache, czyli boleć. And then you say, my leg hurts. My leg aches, czyli po prostu boli mnie. My finger aches, yes? My heart aches. My back hurts, and so on and so on. Both these words mean more or less the same thing, czyli boli mnie coś. Another way of saying that there is something wrong with part of your body is to say, I have hurt my something. For example, I have hurt my toe, czyli uszkodziłem sobie palec u nogi, tak? Czy też zraniłem się w palec u nogi. Czasownik hurt może znaczyć zarówno uszkodzić sobie coś, czyli na przykład, nie wiem, zwichnąć, obić, zmiażdżyć i tak dalej, ale również może oznaczać zranić kiedy jest otwarta rana. So I have hurt my toe, I have hurt my finger, I have hurt my hand, and so on, czyli uszkodziłem sobie albo zraniłem się w coś. Another problem that we can describe, I can't move my, for example, finger. I can't move my leg, I can't move my hand, I can't move my arm. Yeah? So you can't move something that normally you should move. Also, when you, especially if you hit something or if you suffer from a disease, you can say that some part of your body is swollen. What does it mean? Well, swollen means that this part of your body is bigger than it should be. So it has become bigger, czyli po polsku spuchnięty. Yeah, so for example, my neck is swollen. Mam spuchniętą szyję. I don't know, my finger is swollen, my ankle is swollen. So different parts of the body can be swollen. Also, you can say that you have problems or that you have trouble doing some things that you should be normally doing. For example, I have trouble walking. Mam problemy z chodzeniem. I have trouble swallowing, czyli mam problemy z połykaniem. And so on and so on. So you have trouble doing something. Also, you can say that you have shivers. What is shivers? Shivers is usually, for example, when you have a cold or a flu and you start shaking like this. And then we say that you have shivers. In Polish mam dreszcze. Shiver to jest w ogóle też trząść się, a jako rzeczownik są to dreszcze. Also, you can say that you fainted. What does it mean to faint? Well, to faint is a situation when you lose your consciousness, czyli przytomność, and usually, you know, you have no control over your body and you just fall down, you collapse, czyli zemdleć. So you can tell your doctor that you fainted, for example, at home. Yes? Czyli zemdlałem. There is one thing I want you to remember. In English, when you talk about parts of your body, you usually, not always, but almost always, so usually, you have to add to the name of this part of the body, you have to add a possessive pronoun, czyli zaimek dzierżawczy. For example, my, your, his, her, and so on and so on. So if you look at these sentences, you can notice that parts of the body are accompanied by possessive pronouns, czyli zaimki dzierżawcze. I have pain in my back. My leg hurts. I have hurt my toe. I can't move my finger. My neck is swollen. And so on and so on. So in Polish, you usually don't do this. When you say złamałem rękę, you say złamałem rękę. You don't usually say złamałem moją rękę. Yes? You usually don't say moja szyja jest spuchnięta. You just say mam spuchniętą szyję, czy szyja jest spuchnięta. So remember that. All right, so when you have talked to the doctor about your symptoms, you have described the symptoms, the doctor will give you some medical advice. So he will tell you what to do next about your health problem. So what kind of medical advice or also treatment can the doctor recommend to you? So the first one is, I will refer you to a specialist. Refer to a specialist simply means to send officially to a specialist with some information about the visit to the doctor, czyli skierować do specjalisty. Refer means skierować. So the doctor can refer you to a specialist, but if it's more serious or you need more tests, he will refer you to a hospital, czyli skierować do szpitala. Usually the doctors prescribe some medicines. Prescribe, czyli przepisać. So the doctor can prescribe some tablets or pills. It's the same thing, more or less. Tabletki, pigułki. Tablets for something, for high blood pressure, yes, or tablets for an infection, like antibiotics. Another way of saying this is here is a prescription. Prescription, recepta. So the doctor can prescribe some medicines, or in other words, they can give you a prescription for something. For what? For example, for painkillers. Painkillers are all these kinds of tablets or pills that kill pain. Yes? Czyli tabletki przeciwbólowe. Generally, the doctor will prescribe you a medicine or a drug. You have to remember, in English, lekarstwo is a medicine, but medicine also means medycyna. Lekarstwo zazwyczaj ma przedrostek nieokreślony a, medicine, I'll give you a medicine, natomiast medycyna nie, ponieważ jest to rzeczownik niepoliczalny. A drug. You have to be careful about this word, because in the, let's say, popular culture, we like to think that a drug is just narcotic. Yes, we talk about drugs, people take drugs, don't take drugs. But be careful, because this word in English can also mean lekarstwo. So very often the doctors will talk, for example, about a drug for cancer. Yes, we have discovered or invented a new drug for cancer, meaning lekarstwo na raka, a nie narkotyk na raka. A doctor can also prescribe you a vaccine. Vaccine is what we call in Polish szczepionka. Of course, vaccine is something that you get to prevent a disease, not to become ill. So you get it actually before you become ill, not after that. But still, this is something that a doctor can recommend or prescribe. If you have a broken bone, so broken leg, broken arm, broken hand, in other words, fractured, czyli złamany, and it's serious, so the doctor will tell you that you need or we need to put your leg in plaster. Plaster meaning gips. You have to be careful here too, because in English the word plaster can also mean two things which are quite different things. So a plaster, so countable noun, rzeczownik policzalny z przedrostkiem na przykład nieokreślonym a. So a plaster means something that you put on your skin when you have a cut. Czyli jest to po prostu plaster. But if you use this word as uncountable noun, czyli rzeczownik niepoliczalny, so there is no indefinite pronoun, nie ma przedimka nieokreślonego a przed tym, to wtedy plaster oznacza gips. Just like here, we need to put your leg in plaster, yes? All right, now when you are at the doctor's, the doctor will ask you about the symptoms that you have, but they can also, and probably will, examine you. What does it mean? Well, to examine is to make some medical tests on you. Czyli examine oznacza zbadać. Examination, badanie. So doctors or medical examination. So the doctor will tell you, I have to examine you. Muszę pana, panią zbadać. Very often the doctor will ask you to lie down. So there is this special kind of, well, it's not bed. It's something like a settee. We call it kozetka. So the doctor will ask you to lie down here, saying, can you lie down here, please? Czyli proszę się tu położyć. I have to take your temperature or take your blood pressure. Take your temperature means to measure your temperature, czyli zmierzyć, zbadać temperaturę, no właściwie zmierzyć temperaturę. Take your blood pressure, zmierzyć ciśnienie krwi. Zauważcie, że tutaj nie używamy czasownika measure, który zazwyczaj znaczy mierzyć, tylko akurat w języku angielskim używamy czasownika take. Take your temperature, take your blood pressure, also you can take your pulse, czyli puls. Sometimes when there is something wrong going on inside your body and the doctor cannot see it from the outside, you have to have an X-ray done. What's an X-ray? Well, an X-ray is a kind of photography, radioactive photography of your body inside, czyli prześwietlenie albo tak zwanego rentgena. Po polsku bardzo często używa się właśnie tego słowa rentgen od wynalazcy tych akurat promieni, ale w języku angielskim praktycznie to słowo w tym kontekście nie jest używane. Oni używają wyrażenia X-ray, czyli promienie X, bo tak nazywają ten rodzaj promieniowania. So you need to have an X-ray done. X-ray is a very common and very basic type of image of the inside of your body, but now of course doctors have more advanced ways of seeing what is inside your body. So sometimes the doctor may say that you have to have a CT scan. What is CT? Computer tomography, czyli tomograf czy tomografia komputerowa, or you can have an MRI. MRI stands for magnetic resonance imaging, czyli rezonans magnetyczny. It's another type of scanning of your body. So a CT, as I said, computer tomography, tomografia komputerowa, or MRI, czyli rezonans magnetyczny. Very often the doctor wants to see if there is something going on in your body, and they need to test the chemical or biological or chemical condition of your blood. So then the doctor will say you must have your blood tested, czyli musi pani sobie zbadać krew, oddać krew do badania. You must have your blood tested. Of course, there are other different tests that the doctor can, prescribe or recommend. So then they will usually say, we have to run some tests on you. Run tests, czyli przeprowadzić testy, przeprowadzić badania. As I said, there may be hundreds different types of tests that the doctor may run on you. Also, when you are sick, the doctor can recommend some treatment and other medical advice. So what kind of treatment, czyli leczenie, can a doctor recommend? For example, a doctor may say you need to have a surgery. Surgery means an operation, czyli operacja chirurgiczna. Surgery and operation is more or less the same thing. The doctor may prescribe you some pills, but you may also want to ask the doctor about taking these pills. So for example, you may ask the doctor, how often do I have to take this, if it's one thing, or how often do I have to take these, if it's more pills. You may also ask the doctor if this is something serious. Simply asking, is this something serious? The doctor can also recommend some action for you. For example, they may say you have to stay in bed for a couple of days. Or they may say that you have to take these pills, for example, 3 times a day, or every 12 hours, or every 8 hours. Usually, the doctor may want to check you after some treatment, whether you have actually got better, whether you have recovered. So the doctor will say, please come again for a checkup in 5 days. Checkup, kontrola. Czyli proszę przyjść ponownie na kontrolę za 5 dni. Also, the doctor may say that if you get worse, czyli jeśli ci się pogorszy, well, you should call him. So call me, or call an ambulance, yes, or call hospital, or whatever. So just call somebody. Sometimes when you have an infection, the doctor, instead of pills, will recommend giving you some injection, czyli zastrzyk. For example, antibiotic injection. Some people, for example, especially if they have problems with their stomach, they cannot take antibiotics in the form of pills, so they take it in the form of injection. Injection, there is a similar word in Polish, in medical jargon, iniekcja domięśniowa, iniekcja dożylna, czyli właśnie zastrzyk. Po angielsku injection, można sobie to tak skojarzyć. All right, I think after this lesson you will know a little bit more about diseases and about their symptoms and about treatment in English. So I hope you'll find this useful in the future. Thank you very much and goodbye.
Thank you very much. Dziękujemy bardzo, panie profesorze, ale mamy jeszcze pytanie od Marii. Czy rzeczywiście taki temat może się pojawić na maturze?
Oczywiście.
Ustnej. Pytanie o maturę ustną.
Oczywiście, że taki temat może się pojawić na maturze. Dział zdrowie jest jednym z działów zawartych w programie nauczania, co oznacza, że również może się pojawić na maturze ustnej. No, takim bardzo prawdopodobnym tematem jest właśnie wizyta u lekarza, tak? W trakcie na przykład dialogu, który się w trakcie matury ustnej odgrywa z egzaminatorem, może pojawić się właśnie odegranie scenki z wizyty u lekarza i zapewne wtedy można podejrzewać, że egzaminator będzie odgrywał rolę lekarza, a uczeń zdający będzie odgrywał rolę pacjenta. Może oczywiście też w różnych innych kontekstach się pojawić temat zdrowia, medycyny na maturze ustnej, na przykład może to być, nie wiem, opis jakiejś ilustracji związanej z wizytą u lekarza. Może to być na przykład opis jakichś problemów zdrowotnych, które mieliśmy i jak sobie z nimi poradziliśmy. Więc no, w różnych kontekstach może się to zdecydowanie pojawić, bo tak jak powiedziałem, ten temat czy to zagadnienie jest zawarte w programie nauczania.
W każdym bądź razie warto pozostać z nami, uczyć się razem z panem Maciejem. Na pewno dobrze się przygotujecie do egzaminów. Dziękujemy wam serdecznie.
Dziękuję.